Hi everyone, it's Katie Kelly here, back with our Reconnect Health podcast, and I have my colleague Steph Petten here. It's November, and so we are discussing prostate cancer awareness and rehabilitation, and Steph and I happen to be the two at the clinic that treat male pelvic floors, correct?
Correct.
So we're going to have a little chit chat about that. So when we normally get a patient for like a male patient for prostate stuff, we tend to see them after surgery. And it's our job as physios to kind of teach them about the pelvic floor muscles, teach them how to contract them, how to relax them. We give them their training program. But I find that a lot of our male patients don't necessarily know that that's a thing. Would you feel the same way?
Absolutely. There's a lot of time. I mean, now I see there are some of the doctors who are specifically letting them know that we do exist and that they should come and see us. But a lot of times it's not necessarily as soon as I would have expected to see them in clinic.
Yeah, I agree with that statement. And I think that, in an ideal world, if I'm planning someone's like rehabilitation from a prostate surgery, I would actually want to see them before surgery, like what we do with like a total knee replacement or a total hip replacement, right? And I don't think that that's really happening, in Canada as much as maybe we would like it to. Mm-hmm. I use the same analogy as I do with my birth preparation patients. So when I'm treating women who are about to give birth, I always say to them, I would love for you to learn how to use this muscle before you have like a birth or a surgical intervention. Same thing for the men. Like, I would love for them to come in and learn how to use the muscle well before they're worried about like the surgery or the catheters or like all the symptoms that can follow prostate surgery.
Absolutely.
Yeah. Okay, so Steph, why don't you tell me what are some of the symptoms that your patients are coming in with after they've had the prostate surgery?
I think the biggest symptom that people typically want to actually talk about is urinary incontinence. We know that post-prostate surgery, about 99% of people are going to experience some amount of urinary incontinence. Ideally, 98% of those people will then actually recover quite a bit. But I find that urinary incontinence is typically like the number one concern that men are having, as well as erectile dysfunction. So erectile dysfunction is another one that we know is going to impact most people after a surgery. The statistics on that one are a little bit more wishy-washy, a much wider span, but you would expect that it is going to be a bit of an issue. And the recovery is at least about like 30% of the patients that are going to experience erectile dysfunction are going to have some recovery as well. But those are the two biggies for sure, is the urinary incontinence and then the erectile dysfunction.
Yeah, I agree. That's what I'm seeing as well. Why don't we tackle urinary incontinence first, and then we can talk about erectile dysfunction. So with the urinary incontinence, I feel like there's a very set protocol that we see in the hospital system for strengthening exercises. And so you'll see traditionally something like hold for 10 seconds, relax for 10 seconds, repeat that 10 times. Sometimes they add on some other training, but that's like the bulk of what I see generally recommended. Do you see anything else?
No, not necessarily. I will typically also recommend they're doing quick contractions.
Oh yeah, I'll add a bunch to that, but I think like coming out of surgery, that seems to be...
I find that they're just, often people are just telling me they've been told to squeeze.
Yeah, and then they don't have an understanding of it.
Of what exactly that means. But yeah, that is typically more of a squeeze and hold for as long as you can, repeat as many times as you can.
Right, and of course, we're talking about the pelvic floor muscles. Men have pelvic floor muscles. Like, maybe we'll highlight that. So the pelvic floor muscles start at the pubic bone in the front, they sling between the legs, they attach the tailbone in the back, right?
Right.
And so what are some of the cues? Like if you were teaching a male patient how to Kegel, what do you tell them?
I start with 3 different areas. So number 1, squeeze the muscles like you're trying to stop the flow of urine. Second, squeeze the muscles like you're trying to retract the testicles. Think nuts to guts. And then squeeze around the back passage like you're trying to stop from passing gas.
Okay. And I think you're right. I think those are like the 3 types of cues that we see very typically given. What are the mistakes that you see? Like, what do they struggle with if you give them that coaching?
A variety. Sometimes I see people who are actually think that they're doing a squeeze and lift, but they're really doing more of a breath hold and bear down.
Like a...
Yeah, more of that, like, it's all abdominals, it's all glutes, it's everything squeezing, but less focus on actually lifting the pelvic floor, so actually getting that sort of retract, squeeze, and lift sort of feeling.
And in that event, I find they might actually leak sometimes during the Kegel. Like they're almost like pushing down, and they'll be like, I'm leaking during my Kegels, and that's my first tip. I'm like, oh, they might have like a big breath hold that's happening.
Yeah, a breath hold, or like a breath hold and a bearing down.
Yeah.
And just... I also have people who just cannot connect to those muscles, and they're just like, I don't understand. I can't seem to actually get the retraction. I don't seem to even like feel anything at all. Men don't seem to be as familiar with like trying to stop from peeing, so it doesn't seem to be as easy a cue for them necessarily. Stopping from passing gas, most people at least have an idea of what that should feel like.
Yeah.
But I do actually get a lot of people squeezing more into their glutes, like really over-recruiting everything.
Like
and just
bum cheeks are squeezing instead of like around the anus. Yeah. And the other thing too, and this is like in our world, it's being debated quite a bit in the research, is like, how much should we be cueing the men to even squeeze around the rectum when there's like potentially a weakness that's happening more in the front? Because that muscle goes from the front to the back, and they can traditionally feel the back half a little bit better.
Yeah.
But then, like, well, how do we eventually get them to start thinking about squeezing
Just
the
more
front? Yeah.
And sometimes I'll actually recommend that they do it, like, because you can have, men can have a good visual cue of whether or not they're doing their pelvic floor training right. So if you were to stand like naked in front of a full-length mirror, you should be able to see that there is some nut to gut action going on. There should be some lift happening. Like the penis should retract slightly, the nuts should lift slightly.
Yeah. It shouldn't just be like, ugh.
It shouldn't just be a big Hulk movement that doesn't also include that lift.
You're right. Dudes have that advantage where women don't see much in the mirror when they're looking and doing their Kegels. So they have like a visual teaching tool that's available to them. Yeah. I think the other thing that I find is that they get really stuck on this like 10-second hold, 10-second relaxation, repeat 10 times, and like that's enough. But like if that was like your quad that you were rehabbing or like any other muscle, that's not like, there would be so much more variety to it, right?
Right.
Okay, so what are you using? Once people figure out how to do a good contraction, what are you then like adding on? Like what's a program look like?
I will also make sure that in general they're good at managing things like inter-abdominal pressure.
What does that mean?
What that would actually look like is like when you're doing things like transition movements, when you're going from a sitting position to a standing position, that they're thinking about incorporating that Kegel, doing an exhale, so they're avoiding a breath hold in those type of situations. So that could be from sit to stand, that could be lifting up their groceries, or just even physically like throughout the job, any lifting that they have to do, any sort of carrying, that they're also incorporating a good abdominal contraction. But first we want that like pelvic floor activation, engage the abdominals as well, so that we actually have a good core canister connection too. So breath, abdominals, and pelvic floor are all coming into play in their daily tasks. It's something that they are being mindful of. And then just some general strengthening. So I will actually give them things like some functional things to start, some things like squats. So like practicing doing like some squatting with actually like engaging the pelvic floor, and like can they do that sort of thing without actually causing them to have like leaking or like symptoms.
So I think like to break this down for a layperson that's watching, what we will often see is that someone will breath hold a little bit when they do a heavy lift or when they get up out of a chair. And then if there's a weakness in the pelvic floor and there's a loss of support from the surgery, then they'll leak when they do that. Right. And I think that's a habit that a lot of people do anyways. Like you should like watch yourself when you get up out of a chair, you lift something, do you kind of like, like, do you like block your throat a little bit? And whereas they had the prostate there previously to give them support, when that's removed, they're like just the muscles are left, right? Yeah, and I don't think that's talked about a lot. I think they do all this Kegeling, and then they're not taught how to actually use it in activities that they would be doing throughout the day. The other thing I noticed too is that a lot of them are either lying down or sitting to practice their Kegels, and no one ever gets them to practice them in standing. And so they're never like trying to lift up against gravity. And so if you practice in lying, I'm like, well, you're not really having many symptoms that are happening in lying down, so why aren't we getting you in that position where you're actually having the leaks happen?
Right, exactly. And even for the exercise-wise, that's what I find too. I'm like, well, what is causing your leak? And then depending on what they're doing, if they're telling me that, well, I leak every time I try to get up out of bed, or I leak every time that I like stand up from a chair, I leak going upstairs, I leak going for a walk, I'll try to incorporate those sort of movements and like evaluate the way that they're actually moving, and then give them some tips and cues as well to actually like how to do those tasks with a better body mechanic and a better inter-abdominal pressure management. So again, that like avoiding of the breath hold, incorporating the whole core canister to make those symptoms better in those situations.
Yeah, it's so important, I think, to train for when the problem is actually happening. Yeah. Go ahead.
And I think the other piece that is really like lost for people initially is that like they need to be moving, they need to be walking. We actually encourage them to be mobile. Cardiovascular health also really important. We also see that people, the more fit that you are, your symptoms tend to be better overall. So also like encouraging them to be like walking on a daily or like almost daily basis, at least, it can be really, really helpful. I'll usually actually just give them the guidelines that we would like look at for just about anyone, that they're getting about 150 minutes spanned over like 3 to 5 days a week of a moderate intensity exercise. So if that for them looks like walking, then walking, or cycling, or I mean, and even with weight training and things like that as well. Some people are good at getting their heart rate up with that, but I'm also recommending some sort of like cardiovascular exercise to go along with it as well.
Okay, you've touched on two really good points. One, I'm going to go with first, is like this, like just being active and strong. I would love to see that start before surgery if we can.
Exactly. Yeah.
If not, okay, after surgery is happening. But like, if you have weakness in your legs, then you're going to have to bear down and splint more in your abdomen to get up or to lift things. Like, there's going to be more that happens if your legs aren't strong. So I'm like, quads, glutes. Glutes are also like BFF with the pelvic floor. So they help to support the pelvic floor. So I really agree with you that there needs to be some strength training component that's added to it. The cardiovascular component, I also think, is really advantageous if we're going to talk about like erectile dysfunction too. I don't want to jump ahead too fast because there's actually a couple things I want to talk about incontinence still, but
exercise.
You need good blood flow to have an erection, right? And so Viagra came to be. They were trying to make a medication for the heart, and it's just that the vessels in the penis are smaller, so they were showing signs of atherosclerosis and like clogged arteries sooner. And so when they took Viagra, there was more blood flow, and that was more advantageous financially for a pharmaceutical company to sell, right?
Absolutely.
And so I want, if you're not going to walk for your cardiovascular health, at least walk for the health of your penis and your erections. Like, that's the discussion that I have with them.
That is true, and that is a motivator for sure.
It is a motivator. What else did I want to talk about I know what I was going to talk about. You had mentioned quick flicks earlier.
Yes.
Okay, do you want to tell people what a quick flick is and why you would prescribe that as an exercise?
So when you're doing like the quick flicks, basically you're doing like a fast, strong pelvic floor contraction that you're just holding for about a second. I'm telling people typically to do about 10 reps or do them for about like 10 seconds with that little squeeze and then a release. Let it down for like sure you're getting a full good release for at least a second, quick squeeze again, and then incorporating that into the everything else that you're doing. So if you're coughing, if you're sneezing, if you're moving position. So basically it's 10 quick pelvic floor contractions followed by a little release in between.
Yeah, and so that's kind of helpful for like speed maneuvers. Like if you have a cough or sneeze that comes on suddenly, or like you stumble over a curb or something, like you need that reaction time.
Coordination piece, that coordination and there are two different like muscle fibers within the pelvic floor, just like other muscles.
Explain that.
So when we're working on that Kegel and hold, we're really sort of targeting those like slower twitch fibers. So those are the ones that are a little bit more, they can hold a little bit longer, more of your endurance muscle, postural sort of control. And then we look at those like fast twitch muscles, which are those like quicker reactions. So that the muscle can like turn on quickly and fast. So we want that more of like slow, longer hold and that quick, fast reaction, because the pelvic floor is composed of both of those muscles, and they're both really, really important just for different aspects of your daily life.
So really what you're saying is like we need a variety of different types of exercises in a pelvic floor rehab program. We need to make sure that we're doing them in a variety of positions. Right. If someone's leaking with a particular activity, you want to be testing what they're actually doing. Yeah, target that. You want to test what they're actually doing. And sometimes I find that like, well, that's where pelvic floor physiotherapists, that's really where we shine, right? It's like trying to develop these exercise programs that highlight.
Yeah, specific to the person's actual needs. And I find with like in general with pelvic floor muscle training, it's going to take a bit of time to actually like see those like strength and endurance benefits, but that motor control pattern, so that would be like those like getting into like the way that they're doing that particular task, they can see those benefits quicker, and that's helps with the buy-in, helps it feel better, helps it feel like you're doing something that's right. If you're like, I leak every time that I go to stand up, but then you're just doing just the pelvic floor muscle training, lying down, just practicing your squeeze, it's going to take a while before you would see any actual like effect necessarily happen when you're actually doing that task. But if we can look at the task as a whole and give them the cues on things like how to use your body through that motion, how to activate your pelvic floor properly, they'll often see the benefit of that a lot quicker, which helps the kind of like
then they'll stick
the
with the
motivation
program
to continue, right?
Yeah, that's a really, really good point. Okay. Anything else urinary incontinence wise?
There are, I guess we could talk the pacey cuff a little bit.
Okay,
like just like options, other options, or incontinence products, because often people that we are seeing are wearing some sort of like male incontinence product throughout the day.
Either a pad or some sort of pull-up type diaper, yeah.
I find that in general, people seem to like the diapers, like the adult diaper, so to speak. Yeah, because it is a bit more. They're discreet and I think they're a bit more comfortable. Men seem to find those a little bit better. I
think
find
maybe
anyway.
A little bit more secure too.
Yeah.
Yeah. So we do see that, and I'm always one that, like, as they're going through treatment, because if we just ask them, like, are you still using a pad? They'll say yes. I'm like, okay, but how many have you reduced? Are you down from 4 a day to now 1 a day? Like, I consider that to be a big win.
Yeah, absolutely. Yeah, and I tell them that as well. It's just like, well, part of this is going to be monitoring. It's not going to be today you're leaking, tomorrow it's 0, but we want to, like, see those, like, little changes. Yeah. Buy things like that, too, like how many pads are you using and
Yeah. And the biggest complaint that I see about having to wear those products is, like, particularly in the summer months, like if they want to go to the beach or they want to go golfing and it's like already kind of humid and sweaty down there and they don't like having that sensation, because you can get almost like a diaper rash from wearing those
Absolutely,
products, right?
Yeah. And I mean, incontinence can also cause like skin irritation and things like that as well. So I will talk a little bit with them about that if that's something that is bothering them, for even like just like different options for like creams and things like that they can use to protect skin.
But that's where like the penis clamps, which I don't like that term. I like the
the cuff. The cuff sounds a little bit less.
So why don't you describe what? So we've been using of all the clamps that there are out there, we are really using more and more something called the pacey cuff.
Yeah, and I mean there are a variety of like different options, but I just find that this one looks a little bit less intimidating. Yeah. So essentially is what it is. It's like it's a little cuff or clamp that's it's the pacey cuff one. The cuffs tend to be a bit more round. The clamps can be kind of sort of think like a chip bag, like what you close a chip bag sort of with, or a food bag
with padding,
with padding, but that actually goes like towards the tip of the penis or just below the tip of the penis and supports the urethra. It clamps or it cuffs.
Gently compresses.
Yeah. It sounds a lot more intimidating than I think it actually is. I don't find that people necessarily find them that uncomfortable. But it is an option as well for men to stop with that like leaking, because it actually does help to support the urethra and therefore stop the actual leak.
And so as I said, I find like a lot of like my male patients who want to engage in like athletics, they'll use it for that, or particularly in the summer months when they just don't want to have a pad on.
And sometimes I'll just tell them that, like, here's what we're going to, like, here's the plan, here's the program, and, like, these are just other options that, like, you can look at for those things. Like, if there is still, like, leaking with, like, higher intensity, like, activities, or, like you said, in times that you just don't want to have on the pad, that it is an option.
Yeah.
It is an option as well.
Yeah, good product. Okay, thank you for bringing that up. That's a really good point. Okay, erectile dysfunction. This is new territory for pelvic floor physiotherapy, because the research is still coming out whether doing pelvic floor muscle contractions can be advantageous to erection or not. What are your thoughts currently?
Even though there is, we're still in that gray area of the research, like you said, I still think that there is benefit to teaching the pelvic floor muscle training. I just like for people to manage their expectation. So I let them know the things that we do know, the things like what we just talked about with like the cardiovascular training, that we do know can be beneficial. So we do know that cardiovascular health and erectile function are linked. So heart health is heart health. So that's one thing that I just like for people to know, so that we just really want to actually know that is something that we should be focusing on. And there are other like devices and things like that we can sort of discuss with them and recommend. There are some pharmaceutical options that are just kind of outside of our scope, but I do like to make sure that they do know that those things are an option that they can discuss with their medical team as well. Because I am finding that people will come in and they haven't had any sort of anything. Like they haven't touched on the erectile dysfunction. And a lot of times they don't tell you unless you directly ask.
Okay. Pause on this, because I think you're so right. I find that sometimes patients are waiting for the physician to ask about sexual function,
Right.
and the physician's waiting for the patient to ask.
Yes.
So sometimes we're the first ones that are like, have
you know? Yeah.
tried having an erection? And what are
they
your
like? Yeah.
goals? And is it even something that you care about or not, right?
Absolutely.
And I really feel like that discussion needs to happen like earlier in treatment than later. Mm-hmm. I just think like get it on the table now.
Right, 100%, and that is a great point, because the more they know, the more options they have to decide what their actual like goals are.
Yeah.
So I will always ask people, especially like post prostate surgery, I always ask them about like erectile function, and some of them don't really want to go there, and I just kind of let them know it's something we can discuss if they want to discuss. And like you said, like that the research is not necessarily like there yet, but I do feel like it has potential to be going in that direction.
Yeah.
And therefore I'd like to already be incorporating the pelvic floor muscle training, even if we don't directly know right now that it's going to impact your erection. There are things that do point that it does.
Yeah. And so some of the theories behind this is like, oh, well, if you're doing Kegels and muscle, like you're just promoting more blood flow to
right.
the area. Some people are theorizing that if you have bigger muscle bulk, that if you do have blood flow and you can have an erection, that the muscle bulk will then help you maintain erection. Mm-hmm. But everything that Steph and I are discussing, like from this standpoint, we don't have the solid evidence to prove that yet. But these are studies that are being done. But that's kind of where the theory is coming from. Mm-hmm. And then the other very newer idea, and I don't see it done in Canada as much as we're seeing being done overseas, is to use a vacuum pump early on in treatment, to have what they're calling, overseas, they're calling them like housekeeping erections.
Yes, yeah.
So that they're using the pump for a brief period of time just to instill a lot of blood flow to cause an erection.
Right.
And then they reduce it and let it go, and to do that multiple times a day so that like the machinery's still working regularly.
Yeah.
And the research on that has started to show kind of positive findings, and I know that's what's being presented at conferences right now.
Yeah.
But it does take a lot of research before we're ever going to change practices.
100%. But however, like from what I do know with the vacuum, like the vacuum assisted erections, like it's not really a long process.
No.
It's for a matter of a few like minutes a day, really. Yeah. And like, well, even some people will like do it in the shower or something like that. So it's not something like that's taking up a tremendous amount of time. And it doesn't seem to be something that is uncomfortable. No. Like people don't seem to mind it. So, I mean, if it were me and that I was in that situation, I would probably be open to.
It's going to help maintain your sexual health, basically, right?
Right.
And so you're right. I think that it looks like patients are like agreeable to doing that as part of their rehabilitative care, but we need more research to have the physicians buy in on it, to really incorporate it as something that they're going to recommend to their patients right now.
Absolutely.
Yeah. So it's really interesting. So, but I do think, like, you're right. So to have that discussion with patients early on, so that it's something that's top of mind, because sometimes they don't get access to their urologist again for a while. So I'm like, you should know all these things. Put all the questions that you're gonna have.
Yes.
Write it down so that when you do get in for your next appointment, you can ask these questions, whether it is from like a medical. So and it's funny because I do talk to them. I'm kind of like, like there are oral medications that you can take to help with erectile function. And then there's a needle.
The injections.
It's a tiny needle, but it does go into the genitals, and sometimes that's a tougher sell for some of my patients. Yeah. So they might be more try the
vacuum
pump.
versus needle. Yeah.
Exactly.
I find the injections. It sounds like a more invasive procedure, because it is, but yeah.
I know. It's interesting.
But
that's the hot gossip.
But there's options is the bottom line. There's options. I would probably try the pelvic floor muscle training as a first line of defense, because it's going to be beneficial kind of across the board for you anyway, as well as like cardiovascular fitness. Like those things are just like beneficial to your bodies in general. And then, discuss the pharmaceutical or the pump or the injections with your doctor as an option as well.
Yeah, and then see if it works for you, right? Mm-hmm. The other thing I would like to say, okay, ladies that are watching this podcast, because I don't think lots of men really watch this podcast.
I have no idea why.
But I will say the amount of times that I have had male patients come to me and tell me it was like their wife or their partner that caught the changes of the prostate cancer. So you are listening for changes to their pee, like all of a sudden their urinary stream like starts and stops, or they feel like they have to go pee all the time, or they're not emptying well when they do go pee, having blood in their urine or their semen, or a lot of pain coming from like deep to the testicular kind of region. Like, unfortunately, while I do think that men should hold responsibility for their own healthcare, sometimes it's their female partners or their female family members who are actually noticing these changes first and then forcing them to go to get a checkup. But you should be able to kind of, I mean, if you identify those things, I would certainly encourage the man in your life to go to the doctor and discuss those symptoms that they're experiencing. Are there any other symptoms that I'm forgetting there?
I think you hit on all of them. I was just thinking, like, as like just kind of a preventative, like, or early detection, like, there's blood work, there's blood tests that you can be like monitoring, like their PSA levels and things like that as well.
It doesn't need to be like a prostate exam anymore.
That's what I feel like sometimes. Like, I have patients who don't realize that the blood work can be, a good way to sort of monitor and early detect as well. It's not always like a rectal exam that has to be.
That's a very good point, because I do think that sometimes people are nervous to go get themselves checked because they don't want to undergo the rectal exam. But yes, there is a PSA blood work that they could have done before that.
And that way, good. At least if you're going in and you're being told that it's time for a rectal exam, it's time for the rectal exam.
They've got some proof on the paper that it's absolutely it's a good idea. Yeah. All right, well, that's really good. Okay, I hope that was helpful for people and kind of, things to be watching for, what we do as physios for post-prostate surgeries, rehab, and like what that rehabilitative process will look like when you come see a pelvic floor physio. Steph and I are always happy to take on male pelvic floor patients, so you can send them our way at Reconnect Health Center, or we can help you find a physiotherapist elsewhere in the world that is also happy to take on that type of patient. So, thanks so much.
Thank you.
See you. Bye.
Bye.